All right, so hopefully the recording has started. Welcome to BEARCATS Health, Gut Health for Wellness, presented by the University of Cincinnati Alumni Association. I am Bree Coggins, Director of Alumni Engagement for the UC College of Medicine. It's great to see so many familiar faces and names on today. I am co-hosting the session with my colleagues Anna Gormley and Gage Woolley, who support alumni outreach efforts for the College of Allied Health Sciences, College of Nursing, and the James L. Winkle College of Pharmacy. The UC Alumni Association is here to support alumni success by positively impacting personal well-being and professional trajectory of our graduates. BEARCATS Health Sessions provide health and wellness resources, unique opportunities to learn about critical healthcare topics, and tools to improve quality of life for UC alumni and the BEARCAT community. Be on the lookout for more BEARCATS Health Sessions coming up soon. A few housekeeping notes. We talked about it a little bit already, but please remain muted to prevent feedback and background noise. If you have questions during the session, please type them in the chat function. There's a bar of options, and it's the little kind of quote bubble that you can put your questions in there during the session. Gage is going to be monitoring that. We will in real time. So if you have a question about a certain slide or comment that Dr. Nandyal makes, put it in there and we'll address it to make sure we don't lose it and not have time at the end. And as I mentioned, we're recording the session today, and the recording will be shared with everyone who registered here in the next few days, and it will be posted on our Alumni Association YouTube channel as well for future use. So to now introduce our speaker, Dr. Nandyal is a multi-generational BEARCAT. She graduated from UC in biology, then earned her MD at the UC College of Medicine, as well as completing her family and community medicine residency through UC and the Christ Hospital. She has served at the Veterans Affairs Medical Center for 10 years and has been in private practice for over 20 years, shifting to integrative health in 2014. Though her current clinical practice is exclusively with UC students, she continues to teach students across the spectrum, passing the baton of health creation to undergraduates through residency, as well as many public forums. With her patients, she looks to apply tools for root cause analysis, exploring the unique biology of each individual, their health journey, environment, and familial patterns, and emphasizing lifestyle. She focuses on components of sleep, mindfulness, connectivity, movement, and nutrition, prioritizing gut health and the mind-body connection. So welcome, Dr. Nandyal. Stop sharing my slides and let her take it away.
All right, let me try to share my slides. There's the one I want. Okay, let me go to larger mode there. All right, are you seeing me okay for the slides and all?
Yep, I can see it full screen.
All right, and sound okay as well?
So, sound good for everyone?
Okay, well, thank you everybody for joining us. I have the privilege of getting to talk about one of my favorite topics, and that would be gut health. In fact, I love it so much that I have a course that I teach to undergrads, mainly pre-meds, about integrative gut health. So this is an honor to talk to my fellow alumni from UC as well. When we speak about the gut, I wanted to emphasize that this is just one part of so many important pillars of overall wellness. And nutrition, I find, is key. Of course, we can't really talk about the gut without talking about nutrition. But it includes a wellness journey that would not be complete without physical activity, sleep, social interactions, stress relief. All of these play a role in optimal health, disease prevention, and also disease reversal. And we're learning much more about all these different factors regarding oxidative stress, which parallels inflammation, the gut microbiome, which I will talk about, how we rebuild our nervous system, because there is such a thing as neuroplasticity, how we play the cards that were dealt genetically and our gene expression, and the ability to get blood flow to all the different tissues of our body. So all of these things are critical. We're focusing again today really on just the gut and the nutritional components. And maybe we need to deal with all of these other factors at some point down the road. And there's experts certainly for each of these areas. it would be important for me to just pause a moment and say that everything here is really for general educational purposes. I don't want to play the clinician for you. Please see your clinicians for specific personal implementation of these different components. So I did want to put that caveat out there. Again, what is digestion? It's really important that we understand that digestion is really the process of breaking food down into smaller and smaller bits or bites, if you want to think about it that way, because I'll be talking about food as information and that data that comes and the signals that come from the food. But digestion in its essence is really two parts. It's mechanical, the gut actually, and starting with the mouth, chewing and grinding the food, mashing it, massaging it, and then the ability to transmit it from the mouth down into the intestinal tract, where there's further pulsing and moving and squishing of things. So there's the mechanical aspect, but then of course, that's not all that has to happen. There's the chemical component, breaking down the food vis-a-vis the enzymes, the acidity of the stomach, the bile that's made in the liver and stored in the gallbladder. And all those contribute distinctly to the breakdown in the digestive processes. So then we can grab those nutrients. This little simple schematic here shows the basic parts of the intestinal tract, missing the mouth there, as you can notice at the beginning. But the esophagus, again, is just the tube from the mouth to the stomach. The stomach then churns, and it's where a lot of the digestive enzymes and juices are put. The liver and the gallbladder have their contribution, but that joins in the small intestine. Likewise, the pancreas secretes its fluids to the small intestine. Things are propulsed through the gut, and then the large intestine is the last 6 feet, really, of the intestinal tract. And then there's the exit. All of this is governed by signals from the central nervous system, but the enteric nervous system is sort of an independent nervous system for the intestinal tract itself. And so if our brain isn't working optimally, the gut independently has its own nervous system and supply. So again, all of these different processes, chewing, the juices, the transit, the acid defense system, signaling further downstream, the adjustments of pH, because if our acidic contents in our stomach don't get neutralized, that's going to be caustic to the smaller small bowel and large bowel. So all of these different concert, it's just this beautiful symphony of things that are happening or ideally happening all throughout the intestinal tract. Again, a little different schematic here. Not only is that intestinal tract unique in the different components, but with regards to the absorption of various nutrients, it happens in different parts of the gut. So, for example, I think of 3 important nutrients for, if we count vitamin D, in terms of their digestive, they're absorbed in different parts of the intestinal tract. So a disorder throughout the intestinal tract can be spotty. For example, colitis, that would just be here in the lower part of the colon. Doesn't necessarily mean that you'll be unable to absorb certain nutrients that are more small intestinally absorbed. The ones here, specifically iron and magnesium, are high absorption in the upper intestinal tract. Whereas very specifically, and I'll focus on B12 in a moment, vitamin B12 is really exclusively absorbed in the last part of the small intestine, right before the colon. And as you can see, different things, again, are absorbed at different areas of the intestinal tract. So it's important as you go forward to know that it's not just like a diffusion of things into the intestinal tract. There's specific places for those things to happen optimally. It's important as well to know that our mind plays a huge role in this digestive process. About 30% of the stomach acid is initiated before we even put the food in the mouth. if we're in the right state of mind. And I'll talk more about that in a moment, but the way we approach the processing of our food, the preparing of the food, the smelling of the food, even before we start chewing it, is integral in that digestive process. So the way we prepare it, anticipation of it, the contemplation of it really needs more credit, as you'll see in a moment. So again, this is a two-way street, the gut-brain connection. You're probably hearing that term more and more. We're really learning that the gut is really the second brain. As I mentioned, it sort of has its own internal nervous system, the enteric nervous system. As it turns out, it's about 20% this way and 80% this way, gut to brain. And that's largely through one of the nerves that you might have heard about back in the biology days, if you're not in medicine, the vagus nerve, cranial nerve 10, really serves as that two-way highway. But again, the vagus nerve is 80% is going this way, really, in terms of signals. I'll get more specific in a moment about that. So again, about 20% from the brain to the gut, where we're, again, anticipating, we're thinking about that food, we're, if we're really meditating on something, we can smell it, we can almost, you feel the saliva starting even before you put that thing in your mouth. Our appetites are often governed by what's going on in the brain, and I'll speak more to that in a moment, because there's a lot of appetite signaling that's happening more systemically as well. Our thoughts and perceptions, you know how when you've had a bad experience with a food, maybe a stomach virus or something, and it just forever that food is associated with something negative perhaps in your mind. But the opposite is true. You know, we fall in love with a certain food, and that's going to color our digestive capacity for that food as well. I already mentioned the vagus nerve and the parasympathetic signals I'll talk more about. The sensitivity and the motility of the gut is also in part derived from what's going from the brain to the intestinal tract. And again, there's some oversight in the inflammatory processes and more generally in the digestive processes. But I'm not able to see that sidebar. Let me move it. I don't know if you can as well. So 80% is, again, the gut to the brain. And I love this quote by Dr. Maya Sheetreed Klein. It's such a rich quote. The gut is the soil in which the brain grows. So what is that soil? What's happening in that intestinal tract? As it turns out, because there's an 80% of the signaling going north in the body from the gut to the brain, we've learned, and the second brain idea comes from learning that about 80% of the serotonin that we think about as one of those happiness hormones is actually in the gut. So when we take, many of us using antidepressants or anti-anxiety medications, the serotonin reuptake inhibitors, their effect may largely be the effect on the serotonin processing in the intestinal tract. Just fascinating to me. Also, and I'll spend some more slides on this in a moment, but there's a protection of the gut integrity itself, the cellular cell-to-cell barriers that when those are impaired is going to change the signals and change the tone of the immunologic health of the body. So all of these things, and I'll touch more about the gut microbiome, are part and parcel of that conversation that's happening between the gut and the brain. Let's see, I can't move my slides. There we go. So just a little bit of a warning here. Lots of us are on medicine that changes the acidity level of the stomach. And again, far be it from me to tell you what to do about your intestinal tract, but stomach acid medications are one of the most popular medications that are prescribed and that are available over the counter. So just an understanding again of how important stomach acid is for many of the signals and the processes of a digestion and absorption needed for the absorption of many of the nutrients that I'll touch on, the feedback loops to signal fullness, and the propulsion of things going throughout the intestinal tract, as well as our immune defenses. In other words, we are taking in the outside world into our stomach. And when there's not enough acidity, that bath of acid is missing potentially. And this can start a domino effect, a cascade of illnesses or potential hazards when we don't have that stomach acid. But again, working with the clinicians, if you're on one of those medications, just the shortest amount of necessary time to be on those would be optimal. Many things, and specifically, I talk about vitamin B12 a lot with my patients and with my students, because it's one of those that requires this baton relay to really help with absorption. So again, specifically for B12, we know that stress interferes with the production of that stomach acid and the enzyme production. So we'll wrap around, we'll kind of close with talking about stress and its effect on the gut. But when we're under stress, we may not make enough acid. We need that acid and those digestive enzymes to liberate the B12 from the foods. And again, in B12's case, it's largely animal food derived. When we don't chew adequately, we have insufficient mastication. Again, we're asking the stomach to do a whole lot more in terms of the digestive processes. Certain kinds of infections, you might have heard of H. pylori or Helicobacter pylori and others, can change the pH quality in the intestinal tract. And then we need something called intrinsic factor, or IF, to actually grab that B12, and then that complex is absorbed all the way down, as you saw earlier, in that terminal ileum. So if you don't have a healthy terminal ileum, or you're missing your terminal ileum because of a surgical procedure, then that B12 may not be adequately absorbed. So again, just for one example, all the different baton relay processes that have to happen to absorb certain nutrients. It's not as simple as putting it in your mouth and expecting to grab it. So a case in point with an illness or a disorder called GERD, or gastroesophageal reflux disease. Sound familiar? Might have heard it called reflux. This would be something where at any point along this vicious cycle, you could get locked in. So for example, if you've been on antibiotics, and who of us hasn't, or who of us has been unexposed to antibiotics through our food sources and whatnot, that may change the bacterial content of our gut. When that's disordered, we can have a gaseous production. That bloat and that pressure that's building up can cause a weakening of the stomach valve that enters, causes acid and contents of food maybe to enter the esophagus. And then we get that sensation of maybe some heartburn or bloating or a distress in our esophageal intestinal tract. So what do? We grab some antacid medication, which changes the pH, the chemistry of the stomach, which also then changes the bacterial content of the gut. And so you see yourself potentially locked into this vicious cycle. Again, just one example of how easy it is to tip this out of balance potentially. Shifting over to this microbiome idea, I wanted to share with you, in my training and finishing medical school in 1989, we hadn't heard about the gut microbiome yet. It's hard to believe now because it's such a part of my worldview, but we were just really taught about germs being bad. It was sort of that us versus them world. And now we know that we are them, they are us. There's billions and billions of bacteria within us that we coexist with. In fact, we need to function optimally. And that is just a huge paradigm shift. And it's a fascinating new universe of understanding that's really just in its infancy. The human gut microbiome is, again, fascinating. It changes throughout our lifespan, and it really is influenced by our mother's, her microbiome, the prenatal life. It begins there. Our own microbiome begins prenatally. And then the way that we come into the world, vaginal delivery versus C-section, also has an impact. It turns out that the passage through the vaginal canal is our first inoculation with these bacteria, mother's bacteria, into our intestinal tract. Then whether or not she was able to breastfeed us would be another impact on our microbiome. So some of us, you can see already, may have gotten a different start, a more healthy start to our gut microbiome, depending on the way that we came into the world, completely outside of our capacity to influence that from here out, certainly. But women who are pregnant are now starting to make decisions around this, and that those early days and months of our baby's lives may be then something that we can influence with this new understanding. Our choices throughout our adulthood, in terms of diet and lifestyle, as I'm going to share with you a few things, influence the state of our microbiome. And again, the changes in our microbiome we're learning influence the level or the rate of the decline of our physiologic functions as well. And certainly dietary care throughout lifespan is also influential. So again, the influences are broad, and understanding that is in its infancy in terms of our understanding through medical training and whatnot.
Hey,
again, I've touched on some things already: the diet, the lifestyle, the environment, all influence that. And the changes are not immediate, but soon. So in other words, shifting our diet can make an impact within hours to days, for the better or for the worse. And you've probably seen that change personally. I'm going to touch on this bottom left in more detail, the diversity of the diet, and lay out a challenge for you in just a moment. But the diversity of what we eat is impactful. Do we have probiotic foods and prebiotic foods? And I'll define those in a moment. Does our diet contain good fats of the sort called omega-3 fatty acids? And again, the nutrients that are in these various foods are really data, are really signals almost, if you will. So here's this challenge. Really fascinating study came out, I believe, in 2018. I don't have the date visible here, but the American Gut Project was studying people with various diets: omnivore, meaning eat everything, including meat; vegetarian diets; an omnivorous diet that didn't contain red meat, so just a chicken, turkey, and whatnot; vegetarian diet that includes seafood; and then a vegan diet. They've compared all these, and you see the different colors here. The scatter plot was not very different when it came to looking at inflammation and some markers for the health, the immune health of the individual. But when they sorted it based on the diversity of the plants within that diet, under 10 different distinct plant foods versus over 30 distinct plant foods, then they saw a split in terms of the immunologic health or vitality of the individual. So again, the diversity, meaning unique plant foods, was more important than whether or not you had meat and the components of that diet. Otherwise, the plant foods. So my challenge to you is to maybe keep track for yourself as to whether or not you can count up in your diet 30 unique plant foods each week. And that sounds daunting. Just at the start of that, it sounds daunting, because who of us eats 30 different plant foods? But you get to count spices, teas, nuts, and seeds. So it's not just the veggies and the fruits, but you get to include those spices, teas, nuts, and seeds. That makes it much more doable. So for example, if you've got a veggie medley or a salad, and you throw on some nuts and some seeds, and you've got maybe a vinaigrette with some other spices in it too, a little turmeric, you get to count each of those as unique plant foods, and a couple of meals that are really savory and flavorful, including spices, you're going to get to that 30 unique plant foods in a week much more easily than you realized. But I have students and I have patients who are pretty monotonous in the kind of diet that they have. And I tell them, well, if you love broccoli, that's great, but you only get to count it once in this particular experiment. So I lay out that challenge to mix it up, to have diverse plant foods. And as we understand our ancestral diets better, particularly nomadic and hunter-gatherer sorts of things, it was very little hunter contribution to the diet. It was a lot more gatherer. And so the seasons would change their availability of certain nutrients. They'd have to dig for the tubers. The plants would flower, and the fruits that would come out would change throughout the year. So that would certainly be an aspiration for us to get more towards that sort of variety in our diet. So I'll leave that there. If you have some questions about it, you're free to ask me later. So we're talking about this microbiome and learning more and more about what happens when there's an imbalance in our microbiome. This is not new information. We've got a lot more granular about the microbiome. We've started using different terminology around it. But Metchnikoff, way back in 1908, knew something about the gut microbiome. His studies were on Bulgarian farmers and their yogurts. And he won a Nobel Prize for this over 100 years ago. He used terms called symbionts, which were the healthy bacteria and some pathologic bacteria. And when they were balanced, then the system, the immunologic balance of the individual seemed healthier. But when the pathogens, when the pathobionts overtook, were more bounteous than the good guys, it tipped the individual into an inflammatory state. So again, that concept isn't new, but we're just kind of coming back to it and really grappling with it. What is that inflammation idea? So you've probably heard that term a lot. It's out at social media. Inflammation is really an understanding of what we've learned in medical school that the body needs. It's not a bad guy in and of itself. For example, when you cut your hand or a finger, you feel that the repair mechanisms are coming to play. You have pain for sure. There may be some swelling, some redness, some heat that comes to the rescue, bringing all the good chemical components that are needed to repair that tissue. When it's out of control, though, you begin to get this loss of function on top of that. So what we've learned is that microbiome is so important in the development of inflammation. And when there's inflammation locally and systemically throughout the body, tissue injury is a result of that. In the intestinal tract, that can be silent. You may not know that that's going on, but what we have then developing is a progression of an increase in intestinal permeability. I always like to show my fingers as kind of the cell-to-cell junctions that are our intestinal tract. It's really one cell deep between us and the outside world. There's a lot more supportive tissue around it, but the actual cell-to-cell contact needs to be very, very tight between those individual cells. And when there's inflammation, there's more gap between the cells. And that sparks all the defense mechanisms that are coming to the rescue to try to repair the breaches, if you will. That increased intestinal permeability means that those cells don't repair as well. We can then get ourselves into situations of nutrient deficiencies, not being able to optimally absorb, depending on where that damage may be happening in the gut. Can signal food intolerances because, again, the gut, the immune system then starts to say, well, that's not supposed to be here. What's that getting in here? And is that a germ? So I'm going to develop an antibody against it. And then those immune abnormalities can spark this concern we have for the development of autoimmune conditions. And this can then translate to systemic inflammation. So you may hear about the leaky gut situation, but it's really the better term medically is intestinal permeability is increased. For ease, we use leaky gut. This is something that is not just intestinal, and I teach my students that the mouth is really the first part of the gut, and it's the part of the gut that we can actually see. So if you have gum disease, if you have dental cavities, plaque buildup, bleeding gums, these are all signs of concern for that same process happening downstream. So I rue the day that the medical world sort of split apart from the dental world. I really feel like our dental colleagues they should be under the same umbrella in terms of health creation and health addressing our overall health that medical clinicians are. And so oral inflammation is just like the tip of the iceberg potentially for gut, and vice versa. When we don't have a healthy intestinal tract, our tissue repair in the mouth can be compromised. So the two are not distinct. Please tell your medical doctor about things that are going on in your mouth and vice versa, because we need to work together. So just again, a schematic here of how inflammation is being studied in various different health concerns, cancers, pulmonary diseases, neurologic conditions. I mentioned autoimmune concerns, arthritis, diabetes, Alzheimer's disease, and cardiometabolic or cardiovascular processes. So that same process, when we think about it, maybe starting or at least driven by what's happening in the intestinal tract, brings us back to a focus on doing what we can to keep our gut in the best shape possible. My training involves something called functional medicine, and we learned the 5 R's of gut health. Removing allergens and toxins would be part one. How do we remove allergens and toxins? Well, one of the most important ways is to take out the trash every day. So regular bowel movements is an important part of that. For some, it might be taking out certain foods that are driving some of the problem. For some, the top 2 that I find are dairy and gluten, wheats. And that's for people that are suffering, that have some systemic concerns, that we might really want to focus on those foods as part of that. Once again, I'm not telling you to stop those things. Have that conversation, though, with your clinicians. The detoxification happens by avoiding things that toxify the body. I mean, we put things in our bodies to bring down our stress levels, but some of those may fuel some disease within our bodies as well. So here I'm thinking about tobacco, I'm thinking about alcohol, at least using it in moderation. And for some of us, it's like stopping it because it just isn't tolerated well. We also may need to remove harmful organisms. I mentioned H. pylori earlier. These things can drive imbalances, and if we can identify them, then we may want to weed out bad actors and try to reduce and remove the things that are fueling the problem. The second R is replacing. Sometimes we encourage people to use stomach acid and enzymes. Yeah, you heard me say acid. I have patients sometimes dropping acid to help with the digestive process. The opposite of using antacids. Again, I'm not asking you to do this, but it is part of the protocol for some of us under clinical care to use enzymatic support during meals. You've probably heard about probiotics. We may need to, the third R is re-inoculate the gut with good bacteria, ideally food first, and I'll talk about what those food sources are. And then if there's been distress and been poor repair, we now know more and more about certain foods and certain supplements that can be helpful, basically nutrient foods, nutrient-dense foods that help with that gut repair. And some are using herbs. And then the 5th R is bringing a mindfulness to our eating. The relaxation response is so important. So food is medicine. And again, those bites of information. My husband likes me to use the term signals. Food is signals for better or for worse, too. So keeping that in mind. So another way to look at this, one of my favorite authors about food, food health, is a guy named Michael Pollan, and these are a couple of his books. He's not a medical doctor. He's a journalist, but he's written extensively about food. And the little mantra that we have is eat food, not too much, mostly plants. So I've said that in different ways earlier, and so I'll reemphasize some of that at the end. But food being like real stuff, the stuff that comes from the earth, the stuff that you can say is a food, not so much of the packaged and processed chemicals almost that we've begun to include in our food groups. But it's really the goal here is real food. I mentioned probiotics. The term prebiotics may not be as familiar to you, but prebiotics are really the stuff that the probiotics need for their own food. We learned more and more about that, largely fiber-based sorts of things, plant-based fibers that we don't digest very well, but they do. They need those nutrients. And that comes from many of the things that you see here. And then the term probiotics, I try to be food first. I try not to be supplement heavy. In certain cases, that's necessary to try to use some encapsulated forms of these different things. But food first. And so these are some of the sources of probiotic foods. Front and center is the yogurt that you heard me mention earlier from Mechnikov. But kefir, kombucha teas, it's an acquired taste. I love it, but that's sources of good bacteria. Our fermented vegetables, such as sauerkraut or beet kvass, fermented soy products, particularly tempeh, miso. Natto is another one, not quite as popular, very smelly, so I understand. I have not indulged as yet in natto, but natto is something that certain food ways, certain cultures enjoy. The goal is really, again, to reduce inflammation. And as I said, anti-inflammatory foods include the foods that are plant-based, fruits and vegetables, are nuts, seeds, healthy oils, green leafy vegetables, fatty fish, trying to avoid the things at the bottom of this chart. Again, this is a Harvard-based health notes. These are the foods that set us up for hazards. Deep fried foods, soda, and I'll talk more about sugar-sweetened beverages in a moment. We've got refined carbohydrates. I'll talk about sugars quite a bit in a moment. And then processed meats, largely we think because of the sulfites and things around it. Other triggers, again, the processed food, trans fats. Our government's been pretty good about phasing out industry-related trans fats, but still look for that. They're supposed to still label it if it's there, but by and large, I would say avoid it if at all possible. Doing what we can to, again, enhance tissue repair so that digestion improves. I also, myself, in my practice, check for magnesium, potassium, vitamin D. And we also know that centripetal fat, or fat around the middle, the visceral fat, is more inflammatory. So we try to encourage folks to not just lose weight, but try to do the things that help lose weight around the middle as much as possible. Again, if nothing else sticks today, please understand that sugar drives a lot of that. And sugar's also, it makes us feel good for a while. And then we ride this roller coaster of sugar up, insulin up, sugar down, crash, hangry, need the sugar again. We ride that roller coaster a lot. But sugar drives, that insulin roller coaster drives stress and the production of something called cortisol. And then cortisol increases blood sugar, and we get locked in this loop of insulin and sugar and cortisol. And that is one place to break the vicious cycle by dialing down our sweet tooth. I ask my students, my patients, about how strong their sweet tooth is. And it takes some practice to try to turn that dial down. But it really does drive a lot of the problems. How we eat, though, is just as important almost as what we eat. And so, I skipped a slide here. I want to go back to this. That vicious cycle of blood cortisol, insulin, can be mitigated in part by the way that we eat. If we live and eat in a distressed state of mind, it interferes with the digestion. I mentioned that vagus nerve, the signals coming from here to there, part of that 20% is the way that we deal with life's stresses. And life will always have stresses, but we should create as much as possible the opposite, that parasympathetic rest, digest, especially as we prepare our food and especially as we eat it, to improve our digestive processes. So we'll talk about that hypothalamic pituitary adrenal reset, trying to get ourselves more practiced through our breathing, through our meditative processes, through mindful walks, just enjoying the spring as we're walking around, really trying to be in our body at the time. So I think this is one of the things we call the French paradox, where people just enjoy their food. They sit, they eat it. They're not trying to do 10 different things like we do. Guilty as charged, eating on the run, eating while I'm typing. It's like more often try to put away the food while we're eating. Try to just create a calm environment when we're chewing our food, spending more time chewing rather than gulping our food down. And that influences those downstream cascade of events that needs to happen to optimally digest our food. And I've had patients who simply did that, who simply spent more time chewing, and some of their digestive ailments reduced. And so, again, don't minimize the impact that these little things can have on all the downstream effects. So what is mindful eating? It's really not just making mindful food choices, which I would advocate for. In fact, most of our problem is at the grocery store when we're picking out those foods. So if it's not in the house, we're not going to be as likely tempted. So yes, mindfully shopping is important. But maybe, and this is where you can bring in little people, creative cooking times, but important to set at a designated place. We are an empty nest in my household, and so eating at the table doesn't always happen. But if I can get it, eating at the island, at the counter, setting a table there, putting away the clutter, sort of creating an environment where we don't have our phones in our hands, just really being with that food, making it an experience of intention rather than just a job. I got to throw some food in my mouth and run off to the next thing. So try not to multitask. Again, give yourself grace. This is not going to be every time you eat, but the more you can do this, the better. If it's one meal a week, if it's 2 meals a week, better, So the enemy of good is trying to be perfect. Don't. It's not possible. Just more than not. And there's growing data about, say, for example, something like irritable bowel syndrome. When people practice mindfulness, you could see a distinct difference in the symptoms of irritable bowel just by spending more time with some mindfulness practices. This is not specifically at a meal. This study was just in general in life. And I believe it was an 8 to 12 week study. I mentioned sleep on my very first slide. Sleep is so important. It turns out, and we've just experienced time change this last weekend. How many of you, like me, are still trying to catch up? It's supposed to be dark now? And that part of the circadian rhythm, being in sync with nature, is so important. If we are out of sync with our gut's microbiome, because they have their own clock, each organ, as it turns out, each cell has clock genes. So we are often out of sync with our own rhythms, and trying to sleep more, smarter, is important for gut health as well. One of the things that I recently learned about, in the last few years at least, is that the lack of sleep changes our appetite drive. So you might have heard of some hormones called ghrelin and leptin. When we have a lack of sleep, we have an increase in those ghrelins, and it sounds a lot to me like gremlins. So when we are sleepless or sleep deprived, our appetite shifts in a way that's more hungry. We're hungry and we're not actually making good choices, as good choices about our food. So blame the gremlins that develop from a lack of sleep. We also make fewer of the hormone leptin, which sort of turns off those hunger drives. It's more of a satiety hormone. So just even an hour or two less of sleep than we need, or from day to day that you might see happening, can change your appetite signals. So you can blame your sleep as much or more than perhaps the caloric intake that you have, but understand that it changes what we look for to feed ourselves with. A healthy individual that survives to 90 years will have slept, if they've slept well, 30 years of their life, a third of our day and a third of our life. It seems like a waste, but understanding that enables us to live the rest of the 60 years is in a healthy way is so important. I won't spend much time on this. You've heard more about fasting and intermittent fasting. I think there's some power to some of these things in terms of eating in a smaller window of time, fasting mimicking kinds of diets. That data is coming. Those research is going on now. I can't speak to that too much, but stay tuned for more information about the impact that eating in a narrower window of time may have. In other words, giving our gut more time to do its job without food being in there for tissue repair may also have an impact. And I would be neglectful if I didn't mention movement. Katie Bowman is an author, a physical therapist, I believe, or physiatrist, who talks a lot about nourishing movement. So here I am sitting at my desk, my laptop. Even if I'm sitting ergonomically perfectly, I'm static. My constellation, if I were to think about every joint in my body as a star, that constellation is very static. And that's why getting out and moving, things like yoga, one of the things that I do for self-care is making different constellations throughout our yoga practice. At the very least, if you have a desk job like many of us do, standing, stretching, moving in your chair, and not being static through the whole course of your day is so important to not just churn things in the intestinal tract, but to create a healthy body environment that's going to influence inflammation throughout the body, changing stagnation, and just changing that gut-brain axis in terms of that sympathetic versus parasympathetic nervous system. Another study about IBS and yoga, so positive effects as we, again, move the body throughout, and ideally in a good yoga practice, we are breathing, we are moving our diaphragm, we are engaging in a practice that keeps us in our body. That present mindedness is an important factor within yoga, and I think is part of why it helps with those that have an irritable bowel situation. You might have heard about blue zones. This is a National Geographic effort going throughout the globe, finding populations of people who have a preponderance of folks who live well into their 90s. These are not clinging to life 90-year-olds. These are thriving 90-year-olds who are out building fences. They're hiking. They're doing surgery. I saw one group where I think it was Seventh-day Adventist who was still practicing his medical career, doing surgery into his advanced years. They have common factors. They know that bottom of the pyramid is, they know who they belong to. They have family first kind of mentality. They eat wisely. This 80% rule is just filling up to 80%, not to 100%, mostly plants and their fermented foods, their wines and other fermented foods. I didn't talk much about that one, but for those who are in there, wine is one of those. And then they know their purpose and they move naturally. So those are creating health. So let's study the people that do it well. This is how they live well. So the pearls here, don't put malware in your body. Put good nutrients that are bites of nutrient-rich data, limiting the inflammatory drive. Summarizing this as food is medicine, the signals that happen, not too much, mostly a diversity of plants, mindfully eaten, sleeping, mindfully moving. That is what I bring to you today for trying to have a gut health for wellness overall. Back to you.
Perfect. Thank you. We do have one question in the chat. I can let Gage read it out. And then in the meantime, if anybody else has other questions formulating, feel free to type them in. We do have a few minutes until the top of the hour.
Okay. Perfect. Can everybody hear me okay?
Yeah.
Great. Do NSAIDs also affect gut microbiomes? I've heard this recently. Should we recommend I'm not really good at that word.
Acetaminophen.
Thank you. Or ibuprofen when appropriate.
Great questions. Our NSAIDs are basically our ibuprofen, Motrin, Advil, Aleve, these kinds of things. Definitely have an impact on the integrity of the gut lining. We know that we can cause ulcers with these things. So we know it has an impact on the inflammation, repair mechanisms of the intestinal tract. And for gut health, acetaminophen may be preferable, but there's a trade-off. I mean, anything that we put in our body has a trade-off. I can't speak to the actual effect directly on the microbiome from the NSAIDs themselves, but anything that's going to rock the inflammatory and tissue repair mechanisms are probably going to have an impact on the gut microbiome, at least secondarily. That's a great question. I probably will try to go back and dig and see if, have you actually seen some studies with regards to a direct impact on the microbiome? Whoever asked the question? You wanted to share? Yeah, I haven't seen direct impact primarily, but secondarily, I'm quite confident that the data would be there for that.
There is another question. Oh, and you got an answer to your question, actually. It's in the chat. She says yes, but I cannot remember where I heard it.
Okay. Yeah, I have not seen much literature on that as yet.
Thank you. What is your opinion of daily multivitamins?
Nice question. I utilize them pretty much. I remember a flip in my mind when that change happened, because I was always taught that it just made expensive urine as well. So whoever asked that question probably said so, or heard that same thing. What I've found is that that our diets may not be as replete, and for various reasons, as I've mentioned, we may not be efficiently absorbing certain things. So I'm pretty comfortable with a multivitamin for those who are on the run a lot, who not maybe able. I work with a lot of UC students. They're always complaining about the dining hall. So, you know, for them, it might be a little bit of a safety net. But what I'd much rather do is, you know, optimize the nutrient intake, make sure people are getting a good base of a diverse diet, and then maybe test for various nutrient insufficiencies and sort of target treat what we find is impaired or is insufficient. So I target treat more than I would say a general multivitamin. But if you're just on the run a lot and you don't have an optimal diet, or at least are in a place at that time where you can eat optimally, I think it's a little bit of a safety net to make sure that you don't fall below some of the nutrients. But not all multivitamins are equal either. So.
Thank you. Next one on here. What mechanisms of the interaction of the antidepressants in the stomach cause the stomach problems withdrawing from them?
Ooh, I might not understand the question too well, but it might have been getting at the serotonin um, uh, that I had mentioned was largely intestinal, withdrawing from them. Well, for example, there are some antidepressants where you take them, you notice some diarrhea cropping up with them as the serotonin reuptake is inhibited. In other words, it kind of kicks things into high gear with regards to the serotonin's effect. And then stopping them would probably have the opposite effect. So again, I'm not sure I understand the question well, but certainly the on and off again mechanisms would be not surprising. If they could clarify that question, I might be able to answer better.
Perfect. I'll look for that in the chat as it comes along. Next question on here is, can you comment on taking K2 along with calcium for bone strength?
That's whoever asked that's really, really savvy. There's actually two different vitamin K, K1 and K2. And from my understanding, we can get the K1 quite easily through our plant food intake. K2, not quite so easy, but it is very important for bone strength. So when I have the opportunity to, I usually focus on the vitamin D, but a lot of my vitamin D products have the K2 blended with them. So I think it's a very savvy question. And I think that combos of using K along with D is important. Gage, I can see a couple of them. Do you want me to? I see now that question on the omeprazole.
Yeah, that's the next one.
Yeah, so that's also savvy. It's true. What I've heard and what I've read is that omeprazole may reduce the stomach acid, but some of the reflux persists. It's not as if it's happening, but it's not as uncomfortable because that burn factor is not there when the omeprazole is present, reducing the acidity of that reflux contents.
Can you see the next question as well? Do you recommend colonic procedures to support gut health?
I would say the main colonic procedure is pooping. So important again to take out the trash every day. And I do a lot of things to promote that, magnesium, increasing the fiber in the right populations. Probiotics can make a difference there. If they're talking about colonics in terms of enemas and whatnot, I'm very cautious. I really prefer working from the front end, going with the natural progression of things rather than rear end. So there may be data, I don't know it. I try to work from the front end down.
There was a clarification of the question from earlier about what mechanisms of the interaction of antidepressants in stomachs cause the stomach problems when withdrawing from them, and they responded with experience of stomach pain, especially when reducing the dose too fast.
The reducing the dose of this antidepressant, that stomach pain, especially when using. I wouldn't be surprised, at least in terms of churning more propensity towards diarrhea with an adjustment of those doses. It's also important if you're going off anti-acid medications to dial down slowly, because that could cause a surge of acid if you come off of those too quickly. So.
I think that's all the questions.
Yeah, thanks, Gage. Yeah, and we're at 1:01, so I do want to be mindful of time. You can reach out to me. We can relay more questions to Dr. Nandyal if anybody has any other follow-ups. But thank you so much for being with us, Lauri, and everybody who tuned in today. We hope it was a resource to you all. Like I said, we'll share out the recording and be on the lookout for future sessions. But thanks again. Have a great day, everyone.
Thank you.
Thank you.